here has struggled with opening his jaw his entire life, and just now in 45 minutes we were able to get his jaw to be not restricted and he's able to open with full range of motion. Today we are doing a deep dive into intraoral TMJ treatment. Before we begin, hygiene and consent are paramount. My hands are sanitized and I'm wearing fresh nitrile gloves. My client is fully aware of the procedure, and we have established a nonverbal signal if they need to stop at any time. So we begin with the superficial masseter. To palpate this safely, I use a pincer grasp and I place my thumb on the outside of the cheek and my index finger inside the lining of the mouth. I ask the client to gently clench their teeth. That will help me locate the thickest part of the muscle belly, and then they can fully relax. And then, once relaxed, I compress the tissue, sandwich style, between my fingers to assess for density and trigger points. And I'm going to be holding steady pressure where needed. The client can swallow as needed. Next, we're going to access the difficult to reach lateral pterygoid. This is often the culprit for joint clicking. To access it, I ask the client to open wide to stretch the area and then close about halfway. The slack allows my finger to reach further back. Using my pointer finger, I slide along the upper gum line, moving behind the very last molar. I am aiming for the pterygoid fova, a small pocket located near the upper wisdom tooth area. It often feels like a little nook. Once located, I apply medium to firm pressure. I hold this for 10 to 15 seconds using slight circular motions or shifting my angle to encourage release in that deep pocket. Finally, we address the medial pterygoid, which mirrors the masseter on the inside of the jaw. From this position, the patient needs to keep their mouth only slightly open, about 10 to 15 millimeters. I insert my finger behind the lower molars, just in front of the angle of the mandible. The technique here is specific. I am pressing medially inward towards the center of the throat and then angling posteriorly and superiorly against the medial aspect of the ramus bone. Be very gentle here. This area is almost always tender to palpation in TMJ sufferers, indicating significant muscle tension. You doing okay? You comfortable? Mm-hmm. Okay. Gonna clench again. How's the tenderness?
A little tender right there, but
okay.
Not bad.
Okay. And you can swallow as needed. That one on the right is kind of tender, huh?
Mm-hmm.
And open your jaw fully. It's still pretty restricted, so we'll keep working in that area. And close gently. And clench. Okay. And relax. And try moving your chin to the right, so kind of, deviating it. And then move your chin to the left. And then protrude your chin, like you're sticking your chin out. Okay, yeah, that's a pretty strong movement. And relax. Feels like deviation to the left is more restricted for you. Is that what you feel as well?
Usually, yeah.
Yeah. And try opening your jaw again. It looks a little bit better. How does it feel?
A little bit better.
Yeah, I see that. Okay, and you can gently relax. We'll keep working. And clench again. Keep clenching. And relax. You're tolerating more pressure, so that's a good sign, and I can feel the muscles relaxing. I just want to retest your jaw motion. Try sticking your fingers between your teeth and see how many you get in there. 3 almost? 2.5?
Yeah.
Yeah.
Up half a finger.
Okay, which side hurts still?
This side.
The right side,
Yeah.
yeah. I feel it is still pretty tight. Okay, we'll keep working on that area. And laterally deviate your chin to the left. Just move your chin to the left, yeah. And laterally deviate your chin to the right. Oh yeah, it's the tight one. Okay, you relax. Deviate your chin to the right. I'm going to take it slow. And relax. Clench your teeth. Okay, relax. Clench your teeth. Relax. And deviate your chin to the right. And relax. so you can get in between your teeth. 3, yeah. Pretty easily 3. How does it feel? Is it still pretty tight?
A little bit on the right, but
Okay, yeah, I'll keep working on
up
it.
here.
Okay, yeah, that's where the lateral pterygoid lives. So it's, just where the TMJ joint is, near the ear is where he pointed to. I'm stretching and massaging his muscles on the right side of his cheek. So I have my thumb, if you're able to rotate your head to the left so I can show. I have his thumb at the base of his ear and then my finger in the back of his molars, and I'm just pinching and stretching like that. And then you can look straight up toward the ceiling. And that's going to be really helpful to release that last bit of tension so that hopefully I'll have full range of motion by the end of the session. You're able to turn your head slightly to the left. Thanks. Move just your chin to the left. And move your chin to the right. And stick out your chin. So much better. Then clench. Kind of relax. And then try opening your jaw as wide as you can. Wow. Do you feel like it's restricted at all, or does it feel like complete range of motion?
I would say probably full.
Full range of motion, awesome. That's amazing. So if you're a TMJ sufferer, some things I would recommend you to do is to make sure that when you're at rest, that you never let your teeth touch. You want to keep a slight separation between your teeth when at rest. And then the second tip that I have for you is if you don't have a mouth guard, to wear a mouth guard, because a lot of clenching happens at night. And the third thing is you want to make sure that you keep your tongue at the roof of your mouth. So you want to let it rest gently behind your two front teeth. Also, some exercise you can do is just open and close your jaw, but don't clench. And then bring your chin to the left and bring your chin to the right, and then scoop out your chin. Not very attractive movements, but if you do a few of those every day, that should be really helpful. Also, you can massage your outside of your mouth with your hands, and you can go internally with your fingers as well, and then pinch the outside of your cheek with your thumbs, and then the inside with your index finger. So remember, mouth guard, keep a slight separation between your teeth when at rest, keep your tongue slightly behind your front teeth, and also those exercises for a minute or two every day should keep you in pretty good shape. And then come see me if you try those tips and you're still having some pain. Thanks, guys.